Many people have chronic GI complaints and have been to doctors and not received any results because the doctors have not found anything wrong with them via diagnostic testing. What we want to do is ferret out pathology from functional gastrointestinal disease, and when we do that, then we can help the person in front of us to the best of our ability. The journal Nature in 2017 came out with a study that talked about mucosal immunity and gut-brain, brain-gut interactions and how it relates to GI complaints. Well, if you have a GI complaint and you've had a colonoscopy and or an endoscopy and they're positive, then that means that there is pathology there. And that pathology, excuse me, I can spell, that pathology could be Crohn's disease, ulcerative colitis, celiac disease, an ulcer, all kinds of different things. But for it to be pathology, it shows up on the diagnostic test, whether they did a colonoscopy or an endoscopy. If you have a colonoscopy or endoscopy and there is no occult pathology, then they're going to say those diagnostics were normal and potentially tell you that your GI tract is normal and it may be all in your head or coming from somewhere else. But what the journal Nature said is that there's a large burden of people in the healthcare system that do not have pathology on our diagnostic tests, but they still have what are called functional gastrointestinal disease. And classic functional gastrointestinal disease, or FGIDs, would be irritable bowel syndrome or functional dyspepsia, also known as GERD. So these are gastrointestinal conditions that cause a lot of issues and a lot of loss of quality of life and function in people, but do not necessarily show up abnormal on diagnostics such as colonoscopies and endoscopies. That does not mean that you are normal and that your condition is all in your head and that you need an antidepressant. It means that we need to understand the difference between pathology and functional GI issues and know how to address them differently. The functional GI issue could become pathology if not addressed properly. And so essentially the people that have the negative diagnostics is an opportunity to catch them sooner before they become pathology. So the nugget for today is just because your diagnostics were negative or normal does not mean there's not something wrong with you. And if your doctor is not willing to walk with you down that path to figure out why you're still having symptoms even though the diagnostics are normal, then maybe you need a new doctor or you need to enter a new paradigm of care that honors your symptoms and is willing to look deeper and put the pieces together.